Welcome back to the Cornies Notes version. Health matters simplified so you can understand. I'm Dr. Matthew Cornies, a chiropractor. One of the recommendations that I give to my patients is to use ice massage. That's where you're actually massaging with the ice. So to do that, we make an ice massage tool. To make our ice massage tool, we start with a styrofoam cup and a beautiful poodle. You don't actually need the poodle. But we've got a styrofoam cup, and then we fill it not quite to the top with water. Can you see how full we have it there? Sorry, moving it around. Don't drink the water, Luna. That's for the ice massage. Good girl. So we take that, and we put it in the freezer. Carefully, so that we don't spill. And then we leave it in there at least 3 hours, and it'll come out, well, this one obviously has been used quite a lot, but this is the ultimate result. We get a frozen cylinder of ice with styrofoam all around it. That way we can massage with the ice, but we have that styrofoam to protect our fingers so that they don't get frozen. And so let's say we have a golfer's elbow or an inflammation to the medial epicondyle. We'll take our ice massage and we start with a circular motion right at the muscle attachment where the pain is. Then you can strip up and down the muscle that we're working on. As we remember, the golfer's elbow is for flexion. So when we flex here at the wrist, it's pulling on this muscle. So we're going to go back and forth and in a circular motion. If you were doing it for your tennis elbow, it's the same thing on the other side. Circular motion at the attachment point, at the lateral epicondyle in that situation, and then stripping up and down the muscle. You're going to do that for about 3 to 5 minutes as often as you want. And be sure to stretch it before you ice it. Don't stretch it after you ice it. Thank you for watching the Cornies Notes version. And remember, get adjusted because it feels good.